How did LGBTQ plus activism respond to the AIDS epidemic? Imagine a time when a mysterious illness was spreading rapidly, and the government seemed slow to act. That was the early 1980s when AIDS first appeared. The disease mainly affected gay men, but it soon became clear it was a health crisis for everyone. LGBTQ plus activists didn't wait for help, they took charge. They formed community groups to support those affected and to share information. One of the first was the Gay Men's Health Crisis, started in New York City in 1981. They provided counseling, education, and advocacy for people living with HIV and AIDS. Around the same time, the San Francisco AIDS Foundation grew out of efforts to educate about AIDS-related illnesses like Kaposi's sarcoma and to support the community. Early on, the language used to describe the disease was misleading. Terms like gay-related immune deficiency or GRID made it seem like only gay men could get AIDS. LGBTQ plus activists pushed for the use of the term AIDS, which stands for Acquired Immune Deficiency Syndrome, to show it was a health issue affecting many people, not just one group. This helped reduce some of the stigma attached to the disease. Activists also worked hard to get the government to respond better. They testified before Congress and pushed for more funding for research and treatment. Virginia Apuzzo, a prominent LGBTQ plus rights advocate, spoke out about how the federal government was not doing enough and helped create the AIDS Action Council to focus on public policy and funding. One of the most visible and confrontational groups was AIDS Coalition to Unleash Power, or ACT UP, formed in 1987. They used protests, sit-ins, and direct actions to demand faster drug development and better access to treatment. They also fought against discrimination in employment, housing, and health care, making sure that people with HIV/AIDS were treated with dignity and respect. LGBTQ plus activism wasn't just about medicine. It was about fighting social stigma too. Activists worked to change public attitudes, challenge discriminatory laws, and promote understanding. They helped create specialized clinics, like the first outpatient AIDS clinic at the University of California, San Francisco in 1983, which combined medical care with community support tailored for LGBTQ plus patients. Thanks to these efforts, the response to AIDS became more community-centered and inclusive. Activists made sure the voices of those most affected were heard. Their work laid the foundation for ongoing HIV/AIDS awareness, prevention, and treatment programs. They also helped push forward broader rights for LGBTQ plus people, showing that fighting for health and dignity goes hand in hand.